Sun-damaged skin can look in a number of ways. Firstly, there's the acute sun damage. So somebody who's just come from the beach and they're sunburnt. So they're red and you can see where they've had the sunscreen or their clothing and not. So that's an acute injury. But the more chronic or longer term effects of the sun on the skin can be manifested in a range of ways, typically altered pigmentation in the skin. Wrinkles, be they fine wrinkles or thick wrinkles on the skin, and also the complexion the skin may take on a leathery effect in time. Ultraviolet radiation is light that's emitted from the sun as part of our solar radiation, which is non-visible, so we can't see it. But unfortunately, ultraviolet radiation doesn't have many benefits. Ultraviolet C is removed by the ozone layer. Ultraviolet B penetrates onto the skin, which gives you the burning, but doesn't penetrate through the skin. And ultraviolet A radiation has a longer wavelength and can penetrate deeper into the skin. We have pigment cells on our skin, and their purpose is to produce melanin, which is a pigment, to protect the surrounding skin cells from the effects of ultraviolet radiation. If there is ongoing stimulation by ultraviolet radiation, these pigment cells can increase in number. And increasing in number, they give the permanent freckles, or these lentigos. Solar lentigos are the pigmented marks that occur on the skin as a result of long-term sun exposure. Now these are fixed marks, typically on the backs of the hands, and it gets long-term sun exposure and occurs on the face and also across our shoulders. And these appear as angulated, flat areas of pigmentation that persist. There's a condition called melasma. Melasma is increased pigmentation on the skin that typically occurs over the forehead, the cheeks and around the mouth, and often in angulated or geographic patches that are fixed. If there's pigmentation on the skin that's causing concern, there are a number of treatment options we have. There are specific products that can be used to actually lighten the skin. These include the topical retinoids, which are prescription strength, but also there are some chemicals that can depigment the skin, and they can be used in combination with retinoids and also topical steroids to help lighten the skin. Additionally, there are surgical or more destructive treatments such as laser therapy, which can be helpful again to remove the areas of pigmentation. Unfortunately, with all these treatments, any treatment that can cause inflammation in the skin can also increase pigmentation. Wrinkles can occur due to changes in the underlying support structure of the skin, typically collagen and elastin. As collagen breaks down, our skin loses its ability to maintain its supple quality, and therefore surface changes can occur which present as wrinkles. Now, these wrinkles are most common at sites where the skin moves and associated with expression, so typically around the eyes and the forehead is where wrinkles start to develop. Skin can be prematurely aged by two main factors. The main factor that causes advanced skin aging is ultraviolet radiation, and particularly ultraviolet A radiation. Secondly, smoking. And the combination of somebody who has high sun exposure and a smoker can increase the photoaging and the aging of the skin dramatically. The main treatments for photo damage would be firstly, the high-factor sunscreen to protect the skin from any long-term and ongoing changes. Secondly, antioxidants. So topical antioxidants, vitamin C, vitamin E combinations, and some of the newer antioxidants can also help to reduce ongoing damage of the skin. Vitamin A therapy, the retinoids, and particularly the prescription strength retinoids. And these have a marked effect on the skin and can improve the skin quality and reduce the damage that's accumulating in the skin, and to improve the texture and reduce the fine lines.